Hi guys, and welcome back to another episode of Biohack-it. Today I have a really special guest. Dr. Connealy is here, and if you do not know her, you have to get to know her. She's a force in integrative medicine and combining conventional alternative approaches to revolutionizing cancer treatments and prevention. I discovered Dr. Connealy's page when my mother was going through cancer 2 years ago and passed away, and I felt you were such a breath of fresh air to checking off a lot of things I intuitively felt about my mother's treatment, but you and your content and the way you were educating really kind of gave me hope that I was thinking things correctly. So I'm so excited to be able to bring you on and sit down with you and have a conversation this morning.
It's great to be here with you.
So Dr. Connealy, tell us a little bit about how did you get started in looking at cancer from this lens? Because it is a very unique perspective to anybody I've seen in the U.S. looking at it from kind of this lens.
Well, it started a long time ago because I was born in the 50s, and I'm number 3 of 6 children, and my mother was pregnant with me, and she started bleeding. And so she went to the doctor, and they gave her a drug called DES, diethylstilbestrol. And that was a very potent estrogen given to women to not lose their baby and and stop the bleeding. And so I was born in 1957. When I'm a teenager, my parents receive a letter stating that that drug caused cancer in both male and female offspring, hormone problems, infertility, anatomical, etc. Yeah. And so I was a teenager, and I was really good at biology. And I'm like, what could I do in science that I can talk to people? Because I like to talk to people. I don't want to be in Bunsen burners. And so, I can be a doctor. So I went to college and got my degree in biology and Latin, and then I went to UT School of Public Health, and then I went to medical school. And I loved medical school. It was like everything on how the body works. And then I went to training at Harbor UCLA right here in Los Angeles, actually in Torrance. And so fortunately, I grew up very natural. And I grew up on Whole Foods, and my mother nursed us all for a year. She made all of our baby food. I ate liver, sauerkraut, bone marrow. That was our normal food. So now it's all fashionable to do that today, but that's how I grew up. And I remember delivering babies at Harbor UCLA. And my first delivery, my attending doctor told me, so you need to give her anesthesia to do an episiotomy. And I go, well, what if I don't? She goes, well, you may tear, the vaginal tissue. And I said, okay. So I go and cut the pregnant woman, and then I'm looking at the tissue, and you're a brand new doctor. You really don't know anything. And I'm like, oh, I look at it, and I was like, okay, now how am I going to sew this up? And so I was like, this is very barbaric. Yeah. I was like, and then I spent the next 4 hours sewing her up.
Right.
Okay? So I'm like, no, I'm never going to do this again. So it came to me literally like, I'm going to have the mother breathe, and then I would massage the perineum. So back and forth, I told the mother to breathe in, and I'd massage the whole perineum. Anyway, I never did another episiotomy after that. So I know when I was in training, they were like, oh, this is the way we always do things. And that's kind of where we are now. This is the way we do things, and we don't look at anything else. And there's so much disconnection on what really works in medicine, because a lot of medicine doesn't work. And now we have the crises of chronic disease in every age group. And so in my journey, I was fortunate to meet a gentleman who had cancer himself. He had sarcoma, which is a tumor of muscle and bone. And I was at an anti-aging conference in Las Vegas, and he's telling me his whole life story and how they were going to amputate his leg. And he's like, no. So he spent the next 11 years on a discovery odyssey, traveling the world how to cure himself of cancer, all right? So he did, and I'm meeting, and he was diagnosed when he was 22, and I met him in his 50s. So he'd already been alive a very long time for a very, very serious cancer. So I go, oh gosh, I need to know everything he knows. So I did, and he lived in Sarasota, Florida. And he was so passionate about educating doctors and helping patients in a way was so heroic. But, when you have had a poison, it becomes your passion. Yeah. I mean, so many stories are like that. And so my whole pathway is how to look all over the world for the most, amazing ways to heal without harming and hurting a patient.
That's incredible, because I feel that sometimes when you get this diagnosis of a life-threatening chronic disease, you go into panic and then you go see a specialist, and the specialist only sees things from their trained little minute lens and doesn't look at the person as a whole to understand what is the root cause, why this person is so sick. And the beautiful thing I feel about the way you're treating patients and your practice is that you're looking at taking a step back and being like, well, where did you get to this point from? Where did the disease actually come from, and what kind of orchestrated all of this?
Right. So it's interesting because long time ago we taught in medical school how to do a very thorough history and physical. And because when I went to medical school, you didn't have what we have today. Right. And so you had to sit down and spend an extensive amount of time getting a history. History as everything. So when I see a patient, I take them from in utero to where they are now. Wow. And yes, and I take in every little piece of information of that person's health, that person's everything they've done, medications they've taken, stress, trauma, every single thing, because everything matters. And then you really understand where they are today if you do that detailed history and physical. Because you've got to examine people. The body is sending messages and giving us messages. And so we've lost that. Doctors have no time to see patients, no time to talk to patients, no time to get a full-length history, a cursory physical. I've had patients say to me, I've never been examined like this before. And I'm like, that's not good. Yeah. Because they're going to just very distinguished organizations and they are not getting a physical exam.
They're probably not spending the time to bother really going into in depth. So when someone comes to see you, how long is then their initial exam? Because you're so detailed.
Right. So for cancer patients, it's 2 hours for the first visit.
Wow.
Correct. So because you really, you mentioned earlier, we are a entire holistic system.
Yeah.
And everything matters. And people just don't realize the miracle they live in until they get a deadly disease. Okay? And then all of a sudden, they become laser focused on their health, and then they start learning and devouring everything, which should happen from day one of entry into the universe. And so I know from my young patients, I'm so excited because these 30-year-olds are all like fervently, changing the future of medicine. Because I've been doing this alone for a long time, meaning there's a few doctors here and there, but the medical profession will tell you you're, quack, or, that doesn't mean anything, it doesn't work.
Pseudoscience.
Well, yes, but that's not true. I tell people, you can take anything I tell you and go to PubMed. Do your own homework and research, okay? And I said, you can validate anything. And don't take just what's available in the United States. United States today ranks 69th in healthcare. We spend 2.5 times more than anyone else. We have reduced life expectancy in the last 3 years. We're flatline. And healthcare is costing about $4 trillion a year, and we have abysmal results. U.S. is 5% of the world population of 8 billion people. We consume 70% of the world drugs, and we have the sickest people in the world, okay? And if you look, our babies, autism is 1 in 22 in California, 1 in 35 elsewhere. Our babies have eczema, ADHD, autoimmune, so many medical problems, okay? Then you take younger elementary kids, 60% have one or more chronic conditions. Teenagers have the highest rate of anxiety, depression, and suicide, and 30-year-olds are here with cancer. So everyone should be in outrage. Doctors especially, because they're in the front lines, they're seeing it. They should all be together talking about this. Why is that not happening, okay? That isn't okay, because guess what? If the doctors, they're an authoritative intellectual figure, they should be talking because they see the patients I'm seeing. Yeah. And this is not okay, that we're silent about such a big problem.
And when a doctor goes into office, you take an oath to protect your patients. And so many doctors have kind of, and I'll come on and say it, I think sold themselves out on this, not going against the system or not wanting to look a little deeper because their paychecks are involved or whatever, and they're lazy. I think a lot of doctors also become a little bit complacent because they don't want to do the things that you're doing, is look outside, treat holistically. Maybe it takes longer. Maybe the drugs that you give are not as expensive, whatever it is. But I think a lot of people have lost their integrity in the last 20, 30 years of practicing medicine.
Well, our doctors are taught what to think, not how to think, number one. Number two is that they are controlled now by the insurance companies and electronic medical record. They have to fill out that electronic medical record, all right? And it has to have all the, T's crossed and the I's dotted. And so they get paid upon diagnosis. How many diagnoses can I list for you? Because that's how they get reimbursed. So I practiced 38 years ago, all right? It was an indemnity system. You had your medical insurance. They paid the doctor 100% of what? So you saw the patient, you charged $100, you got $100. Now, if you charge the insurance $100, the doctor hopes to get $25. So what incentive is it in it for the doctor to work harder for you and do anything different, okay? And he or she doesn't have the time because they're seeing patients and then they're typing their charts before, during, and after work. And so you're not getting good outcomes. And then doctors today don't listen to the patients because they don't have time. Every patient tells me the doctor doesn't listen to me every single day, okay? And that would be the most common complaint, the dissatisfaction since COVID to now went from 70% to 40%, okay? And in my practice, I would say it's more than that, because I would say that's the most common complaint I hear from every single patient, that doctors don't listen, they don't have options, they don't want to what can we do about this? They don't, there's nothing.
Yeah.
And I had a patient who came in yesterday and had lymphedema. And so she went to a vascular specialist, and she said the doctor was in there for about 3 to 4 minutes and says, there's nothing I can do for you, and walks out.
What?
Yes. Now, this is very common, okay? And so so instead of saying, you can easily say, you know what? I'm really sorry about your condition. I really don't know a lot about it, but maybe I can do some research for you right then and there in the visit, okay? To look at things that maybe sound, possible for, healing, okay? And so this is the norm today. And all they have is a drug or a surgery or both. I had a patient also yesterday, 26 years of age, diagnosed with a serous low-grade peritoneal cancer. Peritoneum is the covering of your abdomen. And so it's interesting because that's why it's very important in her history. So I said, well, why did you have your gallbladder out in 2020? Because you're only 22 years old. Why are you having your gallbladder out? Okay, you need your gallbladder. Yeah. And so she goes, well, I was having so much pain, and they did an ultrasound, didn't see stones, and then they did what they call a HIDA scan to look at the functionality of the gallbladder. And she goes, they said it was not that bad, but the doctor said, we'll just take your gallbladder out so you can eat hamburgers. Now, and she's 22, she doesn't know really probably any different. She doesn't know anyone to ask, or right? And you're listening to the doctor. So here she is, and she goes, Dr. Connealy, I had the cancer then, I'm sure. They just didn't catch it. They didn't catch it. They didn't look at it. I was trained in laparoscopic cholecystectomy, which is removing the gallbladder through the scope. And theoretically, when you go in there, you should look a circumferential view of everything, all right? That probably, because they usually do these procedures in 15, 20 minutes, right? And they think, okay, I'm just going after the gallbladder, not really thinking about the rest of the body. And the doctor first of all should have said, let me do everything to help this young lady preserve her gallbladder. So you and me can both go online and look up how to preserve your gallbladder, right? Especially if she had no stones, no functional impairment. What is she getting a gallbladder surgery? Now, this happens every day in America, okay? Because if you look up why you need your gallbladder, all you will get is surgical referrals.
And listening to stories like this, right, I feel it's so criminal. I think it's so criminal to ruin the life of a young patient because you cannot be bothered to go that extra mile, or you're taxed. You can't just write it off and just move on, because in some aspect, I feel like the American medical system is training this new generation of doctors to be emotionally removed from the patient and not take the responsibility of accountability of, once they walk out of their office, what happens to them. It's a different way of looking at patient care, and that stems from the culture that has now been bred.
Well, it's policy, it's culture, it's expectations, it's insurance companies. It's what they're taught. They are not taught functional medicine. They're not taught nutrition. They aren't taught anything that we should be teaching. I mean, they have courses today, but like you said, the doctor's really not interested. And if they have a lot of school loans and they already work 60, 70 hours a week, they don't have the bandwidth to go down unless there is passion, okay? And so we've got to change. 100 years ago, all doctors practiced functionally all doctors practiced naturally, every single doctor. And then when Rockefeller took over the manufacturing of drugs, then now all we have is drugs. And drugs are either the first or the third leading cause of death, depending on who you read, okay? And so heart disease is number one, again, depending on if it's drugs or not, and cancer, okay? And I always tell people, if our medical system is working, why are the rates of all diseases escalating? Nixon declared war in 1971, and we spend about $7 billion a year, the National Cancer Institute. There are more charities, but more diagnosis of cancer in all diseases, okay? And they expect cancer to grow 30% in the next 5 years. So why isn't everybody seeking every avenue to prevent cancer, correct? Yeah. Okay? I mean, in all diseases. And it's really not that hard, but it's a secret in the United States of America to be healthy. Right now, if you look, we rank, like I said earlier, 69th. Okay, but we spend the most, okay? How come other countries are able to do it? Like Japan, they're living until they're 84. Okay, their obesity rate in children is less than 4%. Ours is 60%, okay? Because we know that being overweight and obesity contributes probably to all diseases. And so the facts are out there, okay? And the fact that everyone's looking the other way, that's a problem. So that's why we have to educate humanity through these forums, because I tell people self-care is the new healthcare. Because people have taken my book and healed themselves. Okay.
Self-care is the new healthcare.
Yeah, and now with Robert Kennedy it's, he has a behemoth to manage. Okay, there are lots of intricacies. So it really needs to be us, each of us, helping each other be the best version of each other.
So everything you just said is the reason I started this podcast. And when I lost my mom to cancer, I knew that it was a cancer. And is it safe for me to say cancer is a metabolic and lifestyle disease?
Oh, yes.
Okay.
Because we know after studying identical twins, they studied 40,000 identical twins,
Right.
and it was what they ate and their lifestyle. Now, more importantly, metabolic is one of the causes, but the other is the mitochondria, okay? So the mitochondria are the powerhouse engines of every cell, and they are responsible for producing your currency of life called ATP. And so now, though, in our environment today, like when I was born and in my generation, there really was no one sick, okay? No one had diabetes. Now, teenagers, it's 1 in 3. 1 in 3.
That's insane.
What is their life going to be like? It's not going to be good, all right? Because we know diabetics suffer from every disease, all right? So they're a teenager. I mean, come on. That's why our life expectancy isn't looking so good. So we've got to all, like I said earlier, we have to start with the intention of the mother wanting to be pregnant, because it starts from the mother, right? Her spiritual, emotional, intellectual, and physical, being needs to be great so that she can create the miracle that she will love and deserve, okay? And now we're living in a world where we are exposed to an innumerable amount of toxicity, whether it's the air, the water, the food. Europe doesn't even allow the pesticides and the chemical ingredients that we allow here in the United States. So everything is allowed, okay, until you get in trouble. I mean, even the glyphosate.
Well, they're coming up with regulation that you can't, sue somebody if you get sick from that anymore. So there's all these lobbies that come in and protect big pharma, big food, big agriculture from people actually getting sick.
Right. And so, but that's not fair. We should all, if you're a company, you should be concerned about the welfare of the human condition, all right? You shouldn't be like, okay, this might hurt. You should say, oh, wow, if that's happening, what are we going to do to change it, all right? And like the weed killer glyphosate, I mean, we know there's so much
Studies on it,
studies on it, what it does. But it's still, I mean, they've seen the connection of glyphosate and cancer, and it's still allowed because these lawsuits go on forever, and whoever has the biggest pocketbook wins. But that shouldn't be the case. That should not be allowed. And maybe we need to educate the lawyers and the judges on this, because look at electromagnetic fields. I mean, there was approximately 4 or 5 years ago a 10,000-page lawsuit that the Kennedy group filed because one of the patients was one of my attorneys. I mean, she was an attorney for them. She was one of my patients. Anyway, and I'm like, okay, it's sitting there. Why are we just allowing people to continue to be ill and sick? And the drug that my mother took, they knew for 40 years it was carcinogenic. We knew smoking was not good, and that was allowed. And it's still being allowed. And smoking is, one of the biggest causes of lung cancer.
Right.
So not the only cause, but it is
one of the
cause.
biggest ones. And it's crazy to me to also see, why do you think more women are getting diagnosed in the last 4 years? I've seen this upward trend of more women getting diagnosed with cancer. So a lot more kids, obviously, we understand why they're developing it, but a lot of women since 2019 to now, that rate is also going up. And do you see a correlation with that in your practice?
Yes. I think I started seeing it about probably 5 years ago. Young people, 20s, with cancer, okay? I mean, I've even had younger than that with very serious cancers. And so you always kind of wonder, whoa, you scratch your head and say, how did this, happen? But it's happening a lot more. But look how people eat, right?
Right.
People eat a lot of ultra-processed foods. My patient yesterday, she grew up and have hamburger helper and macaroni and cheese, okay? She's only 26.
Standard American diet.
Yeah, so, I mean, that's all she knew. But the other interesting thing to her history is she took antibiotics 2 times a year. So she was 26, so she'd probably taken them 50 times. Mm-hmm. So what happens when you take antibiotics? And when I grew up, no one took antibiotics, okay? now people and the parents expect it too in their children. They're like, oh, my kid's going to die if they don't have antibiotics. But what happens when you take antibiotics? When you take antibiotics, you destroy your microbiome. And what do you grow? You grow yeast. And there's a strong connection of yeast and cancer. Of course, there's many different facets of the causes of cancer, but yeast is a big one, okay? And there's a new book out called, he's a new colleague, friend of mine that I just met, called Cancer Resolution. And he had cancer himself, young person from England, who wrote the book because he had cancer and his friend died of cervical cancer. And he basically was a graphic designer but became a citizen scientist on what causes cancer for himself and then for the humanity at large. And he really talks about how yeast is such a big contributor to cancer. But we don't eat well, and parents always ask me, like, well, how did you get your kids to eat well? And I'm like, well, is your 4-year-old going to the grocery store?
Or you.
Okay, are you? Okay. So you can control what is being, the child is being exposed to at home.
Right.
Okay. So you need to have the right foods that nourish and strengthen and heal, just like they do in Japan. Like, look at the Japanese diet, okay? And the fast food for them on the streets are kiosks of sweet potatoes, okay? So we have donuts, pretzels, I mean, really, really not healthy, good stuff, okay? And one of my patients came in yesterday, she's 71, and she was talking about her grandchild, and she's like, her daughter's not feeding her that well. And I said, well, what you need to tell her is, do you give monkeys donuts and Skittles? And she goes, that's a good point, because look what we feed the animals in the zoo, right? We give them we recreate their environment, their food. They're exactly how they would be in the wild, right? Because if you didn't, they would be sick and dying. Yeah. Correct.
So why are we
doing it?
Yes.
Okay.
Yep.
So we're not designed to eat Oreos. We're not designed to eat donuts. We're not designed to eat these ultra-processed foods, okay? Mm-hmm. And then people, because we've become a society of automation, people don't use the 800 muscles. So we should be in perpetual motion on a regular basis and incorporate movement. 100 years ago, people did everything because there wasn't the, quick text, quick fax, quick email, quick whatever it is, okay? There wasn't the machines that we have today. Yeah. And so people relying on technology, but technology obviously hasn't helped us get better. We've only gotten worse. So we really all have to examine our ways. And, I truly would like if we went back to the way things were, 50 years ago. Yeah. And a lot of people really believe that too. And, but we all, right now, I've been saying it's a 911 for years. So we're in the beyond 911. We're in I guess I call it, we're the slow 911, because we've all been talking about this. I mean, at least the people that I know and the doctors and, the community that I'm in, okay, and like all my friends, they want to be healthy. Who wants to be sick? Who wants to have homo interruptus? I mean, really, right? Every patient will tell me, like, I was perfectly fine until boom. And then, of course, they say they'd do anything to get their health back.
Right.
But we need to say, what does it take to get our health back? Because we already know preventive, personalized, precise ways of doing things right now.
Right.
But we have to listen to one another. We have to listen to the people that are doing it and say, well, what works? There's never 100%. Like if I give you a blood pressure pill, I can't say 100% is going to work.
Yeah.
Because that's why they have 5 different classes of blood pressure medicine, because that one might not work. So why wouldn't you look at something that you don't know about, whether it's red light therapy, hyperbaric oxygen, peptide, whatever it is, nutrient therapies. First of all, doctors learn biochemistry in medical school. What is biochemistry? How your body utilizes nutrients, magnesium, copper, etc. and how heavy metals interrupt that Krebs cycle of energy. So they did learn that in medical school, but they have completely
Stopped applying it.
Yeah, stopped applying it. And they tell the patients, I would say universally, the patients tell them that what you eat doesn't matter. Today, that's what they tell
And
them.
it's crazy to me, right? And a lot of doctors do not even have like more than like a couple of hours on nutrition. But what you feed and fuel your body with is one of the most important things, from the water you drink to the air you take in to the quality of air to the quality of the food that you're taking in, makes such a difference to create the terrain and the vessel that then prevents disease. So why it is just shocking to me that they are not taught that, and that's not emphasized enough. I guess because there's no money in being well, essentially, right? So
Well, that's very true.
so
Right.
that's how the medical system is built. And I'll even go a step further. If you look at a lot of medical schools where their funding is coming from, which is why there has to be a dismantling between the lobby groups and their alternative agendas and, you know, Big Pharma's alternative agenda to what's actually being researched and taught in school. And that critical independent thinking starts coming into play, which is why doctors are some of the most brilliant minds. But why have we stopped them from asking questions?
Right.
And if you ask questions, you will get shut down. And if you ask too many questions, you'll get pushed out and lose your medical license. Why are we stopping the most critical part of them being a doctor, which is being investigative, looking a little step further and being like, what is really going on with this patient?
And why is everything happening? Everybody should be asking why. Why did you have blood pressure? When did you develop it? Last year. Well, what happened before last year that you developed hypertension?
Yeah.
Okay. And because most of these things are fixable. I have a practice very large because I'm not the only doctor, and we do not have one drug rep that comes to our clinic. Not one. All right. So if we can do it, that means everybody else can do it.
How big is your practice? How many doctors are there?
We have about 80 people, and there's about 8 doctors.
It's incredible.
Right. And so there's the Center for New Medicine side, and that's for human optimization and chronic diseases. And then we have the Cancer Center for Healing.
It's amazing. I was going to ask you, Dr. Connealy, a couple of things. One is, before I go into, I had one medication that I wanted to ask you about, but supplements. You talk about that on your page. So what are some baseline supplements that people should be on? And then do you see a correlation between certain baseline nutrients, mineral supplements that are missing from people?
Yes.
That is causing maybe cancer, like a vitamin D deficiency or vitamin C deficiency?
Right. Well, first of all, you should start with a ancestral diet, okay? Eating the way people did a couple hundred years ago, okay?
And
they
what does that include?
They
Yeah.
hunted and gathered, okay? You need protein, you need, meat, chicken, fish, eggs, turkey, venison, buffalo, all those things, okay? Then you need fruits and vegetables. That's pretty much, and good fats like olive oil and ghee, butter, all right? So you can get a lot of nutrients, but the nutrient density of our fruits and vegetables are not as great today as they used to be, okay? So you may need nutrient supplementation, all right? So probably one of the most common things I see was vitamin D deficiency. And so even people who are outside in the sun, I see vitamin D deficiency. So vitamin D is a hormone and a vitamin, and it influences thousands of genes. So downregulating and upregulating. So we need vitamin D for many different things, for everything, for our brain, to prevention for cancer, metabolic disorders, heart. There isn't any disease that's not related, okay? So I would say that's a very common problem. Then I would say sometimes I see chromium deficiency, zinc deficiency, and zinc is crucial to your immune system. So I would say those are, and vitamin C deficiency. And I believe, we're the only mammals that don't make our own vitamin C. All other animals make their own physiological vitamin C, and we don't. And we need, I believe, more vitamin C today because we're combating so many different
things
environmental toxins, okay? So then the other big thing that I see is heavy metals in everyone. So aluminum is probably the number one heavy metal that I see. So that's very neurotoxic. And then mercury, and I would say cadmium and lead. So the EPA says there is no safe level of any heavy metal in your body. So, and heavy metals, if you have those, like the cell just doesn't work. I mean, your DNA doesn't replicate properly because of heavy metals interfere with the Krebs cycle of energy. So those are a couple of things that I see. I would say 50% of the population has a methylation problem. So we do methylation investigation on, we take a swab of and then get the genes. There's 5 big genes that are related to methylation, and that's how you make your DNA every single second of every day. And so 50% of the population. So every doctor should be doing it because it's 1 out of 2 people. So it should be standard operating procedures, okay? Then one of the other things that I would see is lots of hormone problems, okay? And not in old people, in all ages of people, meaning your hormones are kind of come to to fruition and completion around 18, okay? And so now we see lots of different hormone imbalances and all different kinds of hormone imbalances. Right. So, and then one of the things you mentioned earlier about metabolic, I would say most people have the metabolic disorder. So their sugar is high, or they have insulin resistance, or they're diabetic. So they're all of those things, meaning, and so some study, I was reading recently that they said 99% of the population has a metabolic disorder. And so that's a big, I would say, probably one of the biggest problem, which contributes to Alzheimer's, heart disease, cancer, and any other autoimmune disease, any other disease.
Is it safe to also say, you and I were speaking about this just before we jumped on, that COVID could be also seen in the category of kind of being a metabolic disorder, and that's why people got so sick? Because they were inflamed?
Right, because of the inflammation that it caused. Okay. And it's interesting, I had a patient come in yesterday afternoon, and she got COVID about a month ago. And I do a blood test called a D-dimer. And a D-dimer tells me you have a predisposition to clot. So a lot of people had clotting problems, right? And so I had given her something to take naturally to prevent the clotting and bring her D-dimer down. But I repeated it, and it was still elevated. And I said, well, what I'm seeing is this takes months to really renormalize. I would say around 3 months. So I said, let's just continue to check it. Take the supplement that I gave you to prevent clotting. And so it was interesting. Last week, one of our very good friends, who's in impeccable shape, he's 60 years of age, takes no medications, does sauna on a regular basis, eats perfectly, physically fit beyond like a young person. And he called me, or not called me, texted me and said, I'm in the hospital. I have blood clots in my legs and lung. And I go, did you have COVID recently? And he said, yes, I took ivermectin and I was perfectly fine in 3 days. And then a week later, the clot showed up. So that is very startling to really hear, because here I had a patient that's perfectly healthy. I mean, not one medical problem, not one medication, physically fit, perfect weight, no blood pressure, no medical problems. So we're learning all the nuances that COVID presented, like the myocarditis. People have been talking about turbo cancer. People have been talking about neurological things. So there's lots of things, and the data is coming out more and more. And so what we have to do is we've got to really, I had a patient who hadn't gotten vaccinated and had a serious brain fog. And then I gave him special IVs, and we got rid of it. Right. And but they've spent billions of dollars trying to figure out long COVID, and nothing has come up. Nothing. No treatment, but there's treatments.
Yeah, because it's metabolic.
But we can't be using, there's no medicines really for long COVID, okay? Well, yes, there probably is some medicines. I err on the side of caution. In science, there's something called the precautionary principle. And my job is, you mentioned earlier about the Hippocratic Oath, first do no harm. So I always go to a natural thing in nature first
yes.
before I use a medication. I do use medications because I use repurposed drugs in cancer, but those are old medicines that we already know their history. And so there's a time and place for medications. And so, but I always want to do a natural thing before I use a medication. Now, I know if you've been a doctor for 30 years, that's all you know is medication. Right. And you always think, oh, can this natural thing really work? People really are doubting that. And I'm like, well, because I've done it so long, I know it works, all right? Just like prevention of being sick, period. I know when COVID came out, we sent all of our patients out, here's what you do, how not to get sick. Yeah. There's a preventive protocol for everything.
Right. That did not require necessarily, interfering in a pharmaceutical way to prevent the spread of a disease.
Right, because you want to try to prevent anything, not treat, okay? And so, but doctors, their toolkit is what they've been taught is medications and or surgery. That's all they know. And like you said, you go to a specialist, and if you go to a cardiologist, all he or she thinks is the heart, okay? Like irregular atrial fibrillation is dramatically going elevated. Well, one of the biggest causes is magnesium deficiency.
Yeah.
And we're living around an electrical field. Have you thought about the electromagnetic fields that could be causing this? And we know that. I have a patient that bought a personal thing that she carries
EMF
with protector because she got the electrical stimulation of her heart. And she said as soon as she did that, she's never had an event again. And so, again, doctors, there's not a lot of doctors talking about electromagnetic fields, okay? And it's that invisible energy web all around us. And people don't understand that we're electrical beings. Everything in our body is electrical. Our brain, our heart, our nervous system, everything is electrical. So we have these man-made electrical frequencies that are interfering with our own bioelectrical physiology.
Right. That completely makes sense to me. I wanted to talk about the use of ivermectin. One, it was used obviously during the pandemic. A lot of, alternative doctors and a lot of the functional community came out and supported it a lot. I mean, it's won a Nobel Peace Prize. But more excitingly, I wanted to talk about ivermectin when it comes to cancer, because there's some new research showing and suggesting that it can be really beneficial to prevent and cure.
Right. So ivermectin, like you said, is a very old drug. And we were using ivermectin before COVID because one of the things that we look for in all of our patients is all the root causes that are contributing. And one of the things that we see is parasites. And there's, over 500 species of parasites. And people think if you live in the United States, there's no such thing as parasites. But there really is. If you look it up, there's books, tons of parasitology. In fact, all medical doctors take, education on parasites. And so ivermectin is a very powerful anti-parasitic medication. It's also a very potent anti-cancer medication. It's one of the ones that interferes with 12 different mechanisms of cancer. Angiogenesis, which is blood supply. It also kills circulating tumor cells, inhibits migration, invasion, all these different pathways. So it is something I have never really given it to for patients for prevention because I have my own preventive protocol that I use for patients. But it was a drug that we used for all different things before, including COVID, parasites, COVID, and lots of different things, because it's a very potent antiviral medication. And so practically most of our patients, if you have an early stage 1 cancer, I might not use it as the first line because the patients have usually a lot to do when they first come in. So, but we use it on most stage 3 and 4 cases of, and not just ivermectin though. We use metformin, we use mebendazole, we use praziquantel, we use other parasite. A lot of parasite medications are anti-cancer, okay?
Wow, okay.
Metformin, which is a drug used for diabetes. And that's a very powerful cancer medication. So there's a famous drug called Celebrex. Celebrex is an anti-inflammatory, very powerful and anti-cancer. So there's about 400 drugs in the literature that have the potentiality to start cancer. So obviously you can't take 400 drugs,
right?
But we use the top ones, like hydroxychloroquine is an anti-cancer medication. So statin drugs actually are used sometimes for anti-cancer. So I always tell people you have to treat the patient with the problem, not the problem of the patient. And you need to individualize your treatment with each one. There's no one size fits all. There really isn't.
Right.
And so, and everyone's not the same. Every individual's an original. So you've got to treat the patient with the problem.
Yeah. And it reminds me, we were talking about parasites and stuff. When Bobby Kennedy came out and said, hey, there was a parasite, like a worm in his brain, he meant a parasite, correct? Because they are brain parasites.
Yes.
And I just found it shocking that people would mock that. And I'd be like, what do you mean? They're good parasites, but when you have an overload of the bad type of parasites, because, we can't be completely, I guess, parasite-free, I would take it, because we live in this world. But you're not meant to walk around with so many parasites in your system. And they show up in organs and tissues and all of that stuff. Am I correct to make that?
They can be anywhere in the body.
Right.
That's why stool testing isn't always adequate, because if it's not in the intestines, it's not going to come out in a stool test.
Right.
So doctors have to have other ways of figuring out if patients have parasites, because it can't be always done with the stool test. Because what if it was in your liver? What if it was in your pancreas? What if it was in your lungs? Then you won't pick up in a stool test.
And then how do you test, how else do you test for parasites?
So first of all of our patients get really good blood work, very comprehensive blood work. Now, not everybody gets the same blood work. It depends what they come in, what they're dealing with. But I think very good comprehensive blood testing is important. I talk about in my book, like inflammation levels, C-reactive protein, vitamin D levels, hemoglobin A1C. Doctors don't even check hemoglobin A1C as a reflection of your sugar over 90 days. So that's a very important marker to check, because if it's high, your immune system is challenged, right? And your cells don't take care of you. So you really kind of need to know that and tell the patient how to fix it. So, because this is not esoteric testing, this is really routine testing that really in this day and time, knowing the statistics that we have, we should be doing very good comprehensive testing. And then I do something called bioenergetic testing. You have acupuncture points all over your body. And every acupuncture point correlates to organs and glands in your body. And so acupuncture meridians have been around for thousands of years. We actually know through MRI studies like what acupuncture points really are. And they're energy points, or if you want another word, is chi points. So if the energy flow is not good, then we know that it can't take care of you and the organ and gland can't work. So everything in life has an energy, right? Every drug has an energy. Absolutely. Every fruit, vegetable, medicine, nutrient, frequency of everything we know. They have libraries on frequencies, And a lot of people have a difficulty understanding energy, But I always tell people, well, like, how do you think your blood flows for you? Like, did you tell it to flow? Did you tell your heart to beat? Did you tell your brain waves to work? No, it's all built in. It has its own, built-in energy source. And so for doctors, because I know years ago when I learned about energy medicine, it was very foreign to me, Because I was like, whoa, this is very fascinating. And then I really mastered it and learned, like, this is an invaluable tool.
Right.
For example, if I draw blood on you today, at 11:05, I'm capturing 1 minute of your blood. So what's going on the 23 hours and 59 other minutes, right? So energy tells me biochemically what's going on, right? If I do a physical exam on you and if I order scans on you, that's the biophysical part, right? And so we also have the bioenergetic aspect. So when we do an EKG, it's an electrical aspect of your heart. If we do an EEG, it's an electrical aspect of your brain. nerve conduction studies are all electrical. So we have to look at the bioenergetic aspect of every human being. So when parasites have an energy signature, just like other bugs, just like all things have an energy signature. So we look to see what could be possibly going on in your particular system.
That's amazing. Like to look at it kind of from that lens and bring back what I hear a lot, with you speaking, what I love is bringing back traditional modalities that have kept us safe and healthy for so long that have kind of been lost, and just going back to revisiting us in that whole self, looking at energy, kind of modalities, and looking at things like the baseline of keeping yourself healthy, root cause medicine, ancestral diets, things that have been lost, I think, with the evolution of the modern medical system and disconnected and disentangled.
Right. Well, we have an algorithm in medicine, and you learn this, and this is what you do. And we follow the guidelines depending on your specialty. If you're a cardiologist, if you're a gastroenterologist, if you're an oncologist, you follow the guidelines, and everyone needs to follow the guidelines, all right?
Right.
So if they don't follow the guidelines, they can,
lose their license,
they can
or whatever,
potentially have an issue. Or if they work for a corporation, the corporation wants you to follow the guidelines, all right? You can't think any differently than that.
Right.
And so, because I'm not a specialist, I'm a specialist in optimizing human beings, and I find that medications and the things that we have available in the conventional paradigm, it's great for scans and blood work and different kind of blood testing that I might need if a patient has a special kind of cancer and I'm looking for a molecular target. Those are amazing, okay? But when it comes for me to really creating a treatment plan, how am I going to persuade the body to heal for you in the least injurious, least immunosuppressive way?
Right.
Now, some of my patients need surgery, okay? Because sometimes you need surgery. And if you had a breast lump, you're going to need to get that breast lump out.
Right.
Okay. But when did that breast lump happen?
And why?
Yes. It started about 8 to 10 years ago, all right? And so in the perfect conditions of cancer, so what are the conditions? What's the physiology of cancer? Okay? You get low oxygen because the cells are stifled with environmental toxins, heavy metals, bugs, inflammation, free radicals, and then you create acidity, and so you have acidic body, so the cells can't take care of you, and then you have an invasion of viruses, bacteria, fungi, and parasites. Then your immune system is challenged. Then we have angiogenesis, which is the body's ability to make blood supply for the cancer. So you have this terrain, what they call the tumor microenvironment, which is published in journals. So we need to unravel the tumor microenvironment in the patient. And we can do that before they have cancer. Because think about it, if cancer takes 8 to 10 years, how many years of opportunity do you have to prevent cancer? So many. This is not a secret.
Right.
All right? And here we are, we are spending $4 trillion a year, and people are the sickest they are, and weak and no energy, and people don't feel good.
Yeah.
What is
every
going
single
on here?
day? Yeah.
So we have to unravel the terrain, the tumor microenvironment that the cancer came in. If I just do the surgery and give you maybe an estrogen blocker for this particular cancer, and then I don't change
anything else, it'll pop up as something else.
Then how the cancer is going to come back, right? And so that's what every doctor should be doing, okay? And we know this. It's in the literature that I was reading on the way here about the tumor microenvironment, okay? And so I can't be the only doctor I know that knows this, okay? And doctors, I just don't think they have been properly educated, informed. And we need to be humble to learning, right? We need to be saying, well, let me look at this. Let me listen to what someone else, even if they're not a doctor, okay, maybe they have information that can transform the future of health and humanity.
Absolutely. And that makes so much sense. And that's where I think that the reason I started this podcast was to bring on voices like yourself so it translates over and influences somebody else and helps get the message out that you're trying to convey here, which is like, we need to be looking at the literature, we need to be analyzing it, we need to be asking ourselves questions, and we need to be giving each other that hope and resources to turn to. So to prevent things like chronic disease, knowing that things like cancer are a disease of lifestyle and metabolic, which can all be prevented. So there shouldn't be this upward curve when there's so much research out there to suggest ways to dial it back.
Right. And the funding isn't there either. So if you're a big institution, you may have the funding, right? But if you're an independent practitioner or practitioners other doctors who
Come together,
we don't have the funding unless we get it from a private source.
Right.
All right. And so I would love for us to say, okay, let's do a study on 100 patients we can prevent and see how long, because cancer is 1 and 2.
Yeah.
So if we took people we've been following for many years and we see what was the common thing that they did to not have cancer.
Right.
All right. But like for me, I'm already maxed out.
Yes.
With seeing patients every day and making more progress in helping patients. I don't have the research arm. Probably if someone came into my clinic and they could easily do it. But these pharmaceutical companies, they have big funding, okay? These institutions, they have
That's
the
what they do.
wherewithal.
Yeah,
yes,
absolutely. That's what they do.
And why wouldn't I know that one of the institutions is bringing in integrative medicine, but what they're doing, it's massage and acupuncture.
Right.
Well, that's all great and wonderful, but there is so much more to integrative functional medicine than massage and acupuncture.
Of course. What's your take on hormone replacement therapy then? Because as women, we're going to menopause even sooner because of the toxin levels in our system and the environment and stuff. And then you have women who right away are sometimes going to hormone replacement therapy. Is it okay? Is it safe to do? Or do you see a correlation sometimes between that and women developing certain types of cancers?
Right. Well, hormone replacement is, first of all, you need to know that there's hundreds of hormones in your body, okay? So women have their thyroid gland, their pancreas, their ovaries, and their adrenals. Of course, you have your hypothalamic and pituitary. Right. And so you need hormones. Hormones are the natural drugs to your body, all right? Males have the same hormones that women do, just different amounts, all right? But hormones make every single cell in every single system in your body work. So you must take hormones for your body to work, okay? Hormones got a bad rap because of the Women's Health Initiative in 2002 or 3 and said, oh, hormones are bad. Well, the study didn't show that. The study showed if you took Premarin, you didn't increase your risk of cancer. They did not use natural hormones. All they used is Premarin and Provera. Well, that's not the hormones that we use in biologically identical hormones. And so hormones are wonderful. They're necessary for your brain, your liver, your heart, your immune system, every single cell to work. Right. So you need to have optimal hormones because as far as I'm concerned, it's a matter of life and breath that you don't have good hormones, okay? And as you age, now, I have young people with menopause at 30 now. So what are you going to do? Tell them they don't need hormones? Of course they need hormones, all right? But it's interesting. Doctors just don't truly understand the invaluable nature of hormones. Like, for example, I had a patient came in. She had a hysterectomy 25 years ago, was only given estrogen, not given progesterone, not looked at testosterone, didn't look at DH, never looked at all the other hormones. Well, here she is all these years not getting the proper physiological levels of all hormones. Right. So I explained to her why she needed it. And she goes, well, why don't other doctors know that? I said, they probably don't read, because hormones have been talked about for now 80 years, okay, 90 years when Premarin came out. And so hormones are essential for your life, your health, and longevity, and for your health span.
Right.
Not lifespan, health span.
Yeah. It's crazy, you know, like I think things, especially women's health, is so under researched and studies. You know, ovarian health is completely not even like researched.
Looked
like,
at.
Yeah, it's like I'm going through infertility right now myself, and it's like a lot of guessing games about why is my body not producing any follicles and this and that, and kind of piecing it together because there's no research really to explain that, right? Why is my body doing this?
Well,
and
after we're done, I will tell you. I just had another idea. So anyway, but after we're done, we'll talk about that. And then you can share your story.
Yeah.
So the other thing is that since the Women's Health Initiative, hormone use went down tremendously, okay? And what has happened to breast cancer? It's 1 in 7, right? It used to be 1 in 12. Now it's 1 in 7. So 90% of women who have been diagnosed with cancer, breast cancer, have never taken hormones, okay? So hormones are not the enemy of your body. Yes. Why was your body made naturally, physiologically with hormones? To go against you? That doesn't even make sense, all right? But doctors truly should have a course in school on hormones to truly look at the studies, read and listen to people who have utilized hormones, and their quality and quantity of life is significantly improved. This is one of my passions, is hormones, because my mother took DES, I never had 2 periods in a row in my life. So I lived a hormonal conundrum. And so when I wanted my babies, I couldn't have my babies normally, naturally, so I had to come up with creative ways to have babies. And then when I delivered my twins 30 years ago, I suffered a very traumatic pregnancy because I had 2 doctors delivering my children. So one doctor was turning the twin with the ultrasound machine, and the other doctor accidentally pulled the cord of the baby out. So they had to do an emergency C-section. Well, I woke up in the most severe pain because they had to do emergency C-section without anesthesia. And so I suffered something called Sheehan syndrome. Sheehan syndrome was your pituitary goes in shock. And so years ago, I had a pituitary transplant outside the country. And so it's not available here in the United States, unfortunately. But anyway, and then after I had that and everything, but I never had natural cycles. So I had to become an expert. Because when you have problems and you go to doctors, I would go to lots of doctors and well-known doctors in their field, and none of them could help me. Back then even. So the problem is exponentially worse now. I would say there's more and more doctors becoming aware, but you can't just learn and read a book. You've got to listen very seriously to the patient. The patient has all the answers to them. They live with their body 24 hours a day. And you've got to be willing to experiment with the patient and develop a rapport and relationship so that you can achieve the best outcomes
for that person,
with that person. Because sometimes in medicine, you just got to experiment and say, look, let's try this month and see how your body reacts. How your body reacts. You have to be willing to do that. And a lot of people aren't patient about that. And we have to be, because everyone wants to give everybody the same thing. And I hear these horror stories, and you need to underdo as opposed to overdo. Like people do pellets. I've been doing pellets for 30 years. It's not a new thing. And then they told me, they had the worst experience. I said, because they overdid. If you underdo, you can always add more. But if you overdo, you can't undo pellets, all right? So there's all these nuances in medicine, and I always tell people, just little bit at a time. The patient will appreciate that too. They don't want like a hammer a lot of times. And so it's just very hard. I think, if you don't have migraines, you're not really interested in migraines, right? So the doctor has to decide, everyone's got a genius. And you want to expand and learn everything about your genius and learn how to lovingly serve humanity.
Yeah. I am just so honored that I got to be able to sit down with you and get to know you a little bit better and bring you to my community, because I think you have such a unique voice, and I think the way you're practicing medicine and helping people with something so chronic as cancer that has become so common. I feel like most people are touched by somebody close to them or in their family. That's how bad it's become.
Yeah, it's a 1 degree of separation. Yeah.
And losing my mom from it was a real battle. And I used to sit there and like really tell myself, I'm like, I don't think you're going about this the right way. But then when I found you, I was like, all the things that I had been thinking about became true. And I was like, why are these oncologists not looking at things like, vitamin D deficiencies and her diet and her trauma history and what has got her to this point, and her mitochondria is really bad. But I'm just so grateful that I was able to, get you to come on and film for our community on Biohack-it. And you're just such an incredible resource and knowledge for a lot of people looking for answers out there.
Well, thank you for having me.
And thank you for taking out the time. I know how busy you are. So thank you for doing this with me.
You're welcome.